A good number of Kenyans are now ignoring the daily news updates by the Ministry of Health on the coronavirus pandemic. 78% of those polled in a survey by InfoTrack said the news updates make them anxious and distressed about the possibility of them getting infected with the deadly virus. 9 out of 10 Kenyans say that the news about COVID-19 has increased mental pressure on them, leaving them depressed. The depression has further been compounded by job losses and dwindling incomes, especially for those working in the Juakali sector. 67% of those employed say they can no longer afford to pay their monthly rent, as well as other utility bills like water and electricity. 54% of those in formal employment say they have been forced to take salary cuts, meaning they can no longer service their bank or SACCO loans.
COVID-19 has affected our lives, and particularly our mental health, in ways untold. For some, the public health actions we have taken, such as social distancing, have brought about anxiety and feelings of isolation.
While this happened, 260 more people tested positive for the virus from a sample of 3,651. 21 patients happily left their hospital beds fully recovered, but unfortunately, 2 patients lost their lives. Meanwhile, the government has now fully rolled out the home-based care for COVID-19 patients who do not exhibit any symptoms.
You have tested positive, but you don't have any symptoms. Number 3 is that you don't have any existing comorbidity or any existing medical condition. And further, we have drilled down to ensure that you have suitable space, probably a well-ventilated room where you can be able to stay on your own, separate toilet and bathroom facilities.
This week alone, the Ministry of Health released 600 patients from various isolation centers to continue with their medication at home. Out of those, 338 were released from the Kenyatta University Hospital, with another 212 discharged from the Coast General Hospital to get treatment at home.
It places a premium on the person who is undergoing home-based care to be able to be a responsible citizen. So if you are to stay at home, then strictly you must stay at home without exposing the rest of your family and the general public.
The government has now confirmed that it has received enough kits to increase mass testing across the country. There is hope that the already overstretched medical facilities in Kenya will get a relief after the government introduced the home-based care for the corona patients. Dennis Matara, K24 for The Punchline.